بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. اليوم presentation هو nicotine stomatitis. What is nicotine stomatitis? Nicotine stomatitis, also often called smoker palate, is a reaction seen on the roof of the mouth caused by extreme heat in the mouth, most commonly from smoking. It is known by many other names, include nicotinic stomatitis, stomatitis nicotina, and smoker keratosis. Nicotine stomatitis. Clinical feature of nicotine stomatitis. Nicotine stomatitis is often found on routine examination of the mouth, as it usually does not cause any symptoms. Sometimes it may be mildly irritating. Initially, there is redness of the hard palate and sometimes the adjusting soft palate. With time, the palate becomes white with a crack appearance likened to a dry mouth. Characteristically, there are numerous scattered red dots. There are the phlegm duct opening of the minor salivary gland. Denture protects palate from the heat stream. The changes are then seen only toward the back of the roof of the mouth, beyond the area covered by the denture. Typical feature. This condition is most often found in older male with a history of heavy long-term cigar, pipe or cigar smoking. Due to the chronic insult, the palatal mucosa becomes diffusely gray or white. Numerous slightly evaluated papules with punctate red center that represent inflamed alternate minor salivary gland duct are not. How is nicotine stomatitis diagnosis? Nicotine stomatitis is a clinical diagnosis based on the pattern of the palate and a typical white crack appearance with a red dots. However, a mucosal biopsy may sometimes be required to exclude dysplasia, oral leukoplakia, oral cancer. Differential diagnosis. Nicotine stomatitis, multiple squamous papillomas, acanthosis, nigrans, Cowden syndrome. Treatment and prognosis. Nicotine stomatitis is a completely reversible once the habit is discontinued. The lesion usually resolves with 2 weeks of cessation of smoking. The severity of inflammation is proportional to the duration and amount of smoking. A biopsy should be performed on any white lesion of the palatal mucosa that persists after 1 month of discontinuation of smoking habit. Thank you for listening.